Hello everyone, my name is Iviana Mixon Brooks, and today I'm going to be talking about fetal alcohol syndrome. So I would like to inform the audience about fetal alcohol syndrome resulting from using some information from the CDC. So according to the CDC, fetal alcohol syndrome is caused by women drinking alcohol during pregnancy, which leads to behavioral and learning difficulties for the mother's young child. So when a mother is pregnant, the mother is drinking alcohol while she has her baby inside her stomach. Either the mother is suffering from mental health problems like depression or anxiety. This can lead her to drinking alcohol while she's pregnant with her child. Which when the baby is born, the young child, the baby, is more likely to experience birth defects like heart defects, face defects, small head, low birth weight, and other birth defects. So, transition 2. In addition to behavioral and learning challenges, alcohol exposure also affects the child's brain development and even the growth. This alcohol exposure can disrupt the brain cells, which can affect the cognitive development and the learning development. These symptoms, along with this, are the small head, below average weight and the height, thin upper lip and wide set eyes, smooth ridge between the upper lip and nose, even possibly seizures, delayed speeches, cognitive difficulties, behavioral problems like hyperactivity, learning and intellectual disabilities or disorders, the lack of social skills, vision and hearing problems. They could have possibly heart or kidney defects, and even finger or limb deformities. So here's a short fact from the CDC. So people with fetal alcohol spectrum disorders can experience lifelong issues, especially young children. FASDs last a long lifetime. There is no cure for fetal alcohol syndrome, but research shows that early intervention treatment services can improve a child's development. So basically, young children can experience these lifelong disorders. There is treatment for this. Even though fetal alcohol syndrome isn't curable, but many interventions and treatments can help people, especially young children, reach developmental milestones and improve their functioning. Children who receive early diagnosis and supporting services are more likely to avoid especially anxiety and even depression. Supportive services could include special education, medical support, psychiatric treatment, and mental health intervention. Even though avoiding alcohol is the only way to prevent alcohol syndrome, there are still more treatment options that can help children manage the symptoms. Special education programs can help children with learning difficulties, they can have accommodations at school. Speech therapy can strengthen their communication skills, improving their pronunciation and language, and even their language delays. So I'm going to tell you about my story about how I was born with fetal alcohol syndrome. So in conclusion, I was born with fetal alcohol syndrome along with me having learning disabilities. Even though I have a learning disability until this day, I use my accommodations and special education resources at school, even in college. Although I still have a difficult time in learning, it takes a process, and I'm happy about that as a disabled person. Thank you guys so much for your time.